Thank you, everybody who decided to join us. It's our second event about how to become a sponsor for Ukrainian refugee. We have three nonprofit organizations here. It's and three representatives from these organizations who joined together to create hub in Seattle area to support refugee and support communities, our community in terms of new coming Ukrainians and people who wants to help them, people who are really passionate about this entire situation. We know that it's been a year already since a full-scale invasion, but it unfortunately the more and more cities and villages been impacted by this war, and more people needs to save their lives or well-being and move to another country or find another ways. It's a long and hard process for a lot of people, and we as immigrants, as I myself, know it's not an easy process. And if you're running from something, it's even harder than live in a country that's in peace. And I think today's topic to share some experience about it, and but also help people to understand how anyone in the community can help. But also it's not only about financial help, but also moral, psychological support from each and every one of us. So we will start with a short kind of presentation from each organizations that is involved in this hub. And I think we'll start with Oleg Pinda with the Ukrainian Community Center.
Hello, everyone. So my name is Oleg Pinda. I'm Executive Director of the Ukrainian Community Center. This is the social service providing agency that provide immigrants psychological and some other services to refugees and immigrants in around King County, Kings, Snohomish, and Pierce County. Our agency, together with two partners, been working on this U4U hub, helping sponsors to petition and bring here new refugees. So that's kind of in short. You can check our website, uccwa.org, for more information what services we provided at the center. In this particular program, we have a dedicated phone line. If someone is interested and doesn't know how to complete the form, what form to complete, what the process, what involves in all of that, so you are welcome to give us a call, and we will be more than happy to guide you and to lead you through the process. So that's kind of brief of our agency. Thank you.
Thank you, Oleg. And our next partner is Tamara with the Nashi Immigrants Health Board organization.
Hello, thank you, and I apologize about the technology, trying to unmute. Welcome, everyone, and we really appreciate you coming to our webinar today. As we heard, three organizations who care deeply about the outcomes of Ukrainians in Ukraine and in the world, and especially in our community here, are trying to support sponsors who will be working with Ukrainian refugees in that process. Briefly, our organization is called Nashi Immigrants Health Board. We do have a health focus, and we have lots of scholarly work that we do through the University of Washington. We basically were created via support through the Department of Health so that we could bridge our community with the health and social resources that are available to them, and kind of break down those cultural barriers for folks and language barriers so that they can receive what they need within the spheres of health and social services. So we are all partnering together with the other organizations through Welcome US to be able to provide this for our new arrivals here in Washington, since we have a large amount of new arrivals. And I think in Washington, the last number that I heard in the data was around 16,000 new arrivals in our state. So I'll be talking about our sponsor toolkit later, unless I'm talking about that now.
In a couple of minutes.
Okay, thank you. I will let the Ukrainian Association go. Thank you.
Yes, thank you, Tamara. Yeah, I'm a representative of third organization, Ukrainian Association of Washington State. My name is Irina, and our organization decided to join this hub because we've been here for forever and ever. We started in 70s and been present since pre-active in communities in the Seattle area for many, many years. I think it's a well-trusted organization. We have a lot of connections with politicians and community in general. This is why we decided to join this project, even though we haven't had much focus on the immigrants or not immigrants, but refugees, helping in terms of anything with settlement or supporting them as a like Oleg, for example, with their organization. But we really like to focus on in the past, before full-scale invasion, we like to focus on the community, on the cultural aspect, educational aspect. We supported many programs with languages in our area, like a dance ensemble, Barvinok, school Viri. So basically, our main focus was on the cultural and educational aspect before full-scale invasion, of course. And then our focus shifted. We shifted to humanitarian help and help with the community. In short, we are trying to help each other with this big organization, with all three big organizations, to support our community as much as possible. And that's why we joined Welcome US, .us in this big project. And we hope we can help as many people as possible. So that was our three organizations. And I think next thing on our agenda is tomorrow with a toolkit that might be really helpful for everyone who's coming, but also for sponsors. If you're looking for an information and how to help people who's coming, or if you think you want to help people who's coming. Thank you.
Hello again. I will be talking a bit about some of the structure of our communal grant and how we can support sponsors and newcomers in these processes. So I'm going to share a few slides. Okay, can everyone see the slides?
Yes.
Okay, thank you. So I'm talking specifically about something that we've created to support sponsors. It's called our Sponsor Toolkit of Resources. So I will provide a brief introduction. We'll talk a little bit about sponsor navigators and our sponsor toolkit, and then we'll take some questions as needed. So I wanted to just share some definitions based on some of the things that we all really care about and why we're doing this work in the first place. So the definition that is formal from the Oxford English Dictionary of a refugee is a person who has been forced to leave their country in order to escape war, persecution, or natural disaster. And this is something that we in our community are supporting because the people that are coming here to connect with our community are having this experience. They've escaped war and persecution. So in terms of looking at how we can support them, because our organization is based in healthcare and health and social services, we support the vision of supporting the social determinants of health and elevating those so that the new arrivals who come to our community will be able to be uplifted and supported through the process of coming into this new country with all of these new experiences. We know that age, gender, income, education, housing, employment, English language proficiency, race and ethnicity, and social support are all determinants of good health and outcomes in terms of people in our society. Refugees will always have barriers when they're coming to a new country in order to be assimilated. There will be all of these barriers that are listed here for them to be able to achieve a healthy life and a stable life. So part of this program is to provide some of the support for the sponsor to assist the refugee to be able to have to elevate that in terms of their social determinants. So all of our programs were designed, we have 3 organizations and we have a sponsor navigator for each organization. And that role primarily has been established to connect the sponsor to the resources that are within the community that are trusted and known. And then we also can bridge cultural and language barriers because of the descriptions of our organizations that we just gave. We are really committed to doing that so that there's a smooth and supportive experience. We also are supporting the process and the transitions that we go through when a newcomer is coming here in terms of specific from Ukraine. We know what this might be like in terms of what are the barriers to smooth processes and transitions, and we can provide that support. And very importantly, we all know that if someone's coming from a different country or culture, the process can be really overwhelming, being in a new country with a new language and culture. So we want to strive to provide those cultural connections to those people because we know, and data shows that providing those resources and connections increases the positive outcomes for the newcomers. So we've created a sponsor toolkit. And the main objective of the toolkit is for sponsors to have a one-stop shop to guide them in the process and connect to resources. And I will go through a few areas of the drive that we have in terms of the resources. But because all 3 of our organizations are connected to the greater Washington area, we are constantly receiving new resources, new updates in the changes that occur for refugees and their status in particular areas of the social determinants of health that I talked about. And we will update the sponsor toolkit with the newest information because that is what people will go on in terms of being able to achieve what they need for stabilization of their newcomer. So I can show you a little bit of the features of the toolkit, and then if there are any specific questions, I can answer those. So I just want to share a few areas of the toolkit that may be really helpful and hopefully easy to navigate. All right. So we have currently we have a Google Drive that we share with sponsors to be able to, hold on a second, let me get this up here for us. Okay, so we have a drive where we've placed important resources that would be really helpful. And as I said, a one-stop shop for a sponsor thinking, oh, you know, how can I support the newcomer with specific things? And we have, for example, checklists that we have for our sponsor checklists and the service checklist from Welcome US, where there are recommendations if sponsors need to figure out and what things are important to get in place for this arrival. They have detailed information around that. For example, we also have resources for healthcare. And they include everything from dental care to finding providers that speak the languages that our new arrivals are preferring to speak with. We have a lot of resources on free and reduced care, how to sign up for health insurance, how to find a navigator to help with that process specifically, and also about vaccinations and requirements for new arrivals. We also have other information that has to do with mental health support, employment, food services and resources, housing, which is a really big area that our newcomers will be accessing, learning English language, resources for children and infants and getting into school, attending school, transportation, cultural understanding and resources surrounding that topic, what organizations support our community that we can connect you with, and where to find information. We also have one file that links you to specific resources that aren't downloaded as a file that also provide really important support and information for our community. So in a nutshell, that's our one-stop shop area of development that we wanted to create for all of our potential sponsors for you to navigate things easily. So if anyone has any specific questions, please put them in the chat or raise your hand, or I can answer those at the end of the presentation as well.
Think no questions for
There is
now.
in the chat.
In the chat. Okay, just
Chat here.
that's a good question. What are costs and expectations from sponsors? Oleg, would you be able to answer this question?
Sure, I'd be happy. So first of all, there are no costs to become a sponsor. All applications are filed online through the USCIS website, where a potential sponsor has to create an account and complete immigration I-134 form for each of the sponsor family members. So there is no cost associated with applying for a sponsor. The cost possibly might be when sponsor would help with the airfare getting to the US from the country where Ukrainian refugee presently is located. Secondly, it is expected that sponsor would provide some housing accommodations to the family for the first few months. According to the laws, Ukrainians who arrived to US under this program are eligible to get employment and start working from the day one after their arrival. Meanwhile, even they are entitled to work, they still have to petition for the work authorization documents and file for Social Security cards, which presently time of processing application for employment authorization card, now it takes roughly about a month, might be a little bit over a month. Because of the number of petitions that have been filed. At the beginning, when it's been in the expedite process, people have been waiting for 2 weeks. So now about a month. After filing employment for authorization, there's a check mark that person needs Social Security. So as soon as immigration approve employment authorization, they are in communication with the Social Security Administration, and again, average from 2 to 3 weeks, a person would get a Social Security card. And as they start working, you know, they've been going to be able to support themselves. Beside that, as they qualify under federal refugee status, they are eligible for financial assistance through the state and federal entities, meaning they are eligible for some cash assistance, for food stamp, for Medicaid. So basically all these major expense or possible expenses are met by the state and federal on the state and federal level. And in no means government would pursue sponsor to pay back expenses that government pay for the refugees. So it's not like a regular family petition where sponsor is liable for all expenses that beneficiary would face here in US. So there is no expense on that side. Besides, there are several, quite a few organizations that provide assistance with all paperwork, with employment search, with immigration form petitioning. Like our agency, we complete all the forms for new arrivals completely free. So there are many other resources available. So making sure answer to the cost expectation from the sponsor side. Again, it is.
I think it's cut off, Oleg, a little bit. Okay. I think Oleg answered most of the questions on the site. Answering, Tamara, could you please add the Metut website to the chat? So all our resources available on our join website, and Tamara will add it to the chat. I see also a question about pen statement. I hope Oleg will come back and might help answer that question. And about completed the form, we actually have an announcement about the workshop on the welcome.us website that they have information how to fill up the form. So if you can join them today at 2 o'clock, fortunately it's kind of happened in our presentations happened in the same day. I will post the link to the second presentation at the end of our event, so nobody will lose it. Okay. I see question from raised hand from Adnan.
Yeah, thank you, everybody. My name is Adnan. Slava Ukraini.
Heroes.
I have a question. It was for Oleg, but also for people that are working in the sphere. And it's following up on what Oleg was speaking about. So the Uniting for Ukraine website says that this program is not legally binding. So my question is purely pragmatical. Do sponsors have any legal accountability for people they help after they arrive into United States? For example, if sponsor, or if these people get in trouble, or if these people, let's say, accrue debt, can I, as a sponsor, be held legally responsible for paying back their debt or for any of such thing? Thank you for your attention.
Yeah, not at all. Sponsor is not legally liable for any debt that refugees would possibly get in here in the US. So again, I apologize, I was dropped off. I'm not sure, is it my internet connection or something? But yeah, that's absolutely true. And contrary of family petition, where sponsor petitioning for their family relative for permanent residency for the green card. In this case, sponsor filed a special affidavit of support, which makes sponsor liable for the expenses of the beneficiary. In this program, as beneficiaries who arrive in the US, they qualify under refugee definition. Sponsor is not liable to any debt for the refugees in the US. However, sometimes sponsors become co-signers when refugees applying for a new apartment, and some apartments management required a co-signer since the refugee doesn't have any prior rental history. So if someone would co-sign, this is a different story. So co-signers are liable for the documents that they sign. But in general, sponsors are not liable for any financial debt of the beneficiaries in the US.
So all the obligations are the ones that you take upon yourself voluntarily, basically.
That is correct.
Yeah. Thank you very much, everybody. Thank you.
Thank you. And I haven't checked in the chat since I was disconnected and seen one hand was raised. Any more questions?
I don't see. I think was question about time. How long does it take? Estimated time of approval of a sponsor and travel authorization.
So approximate time of the application for the sponsors relatively very quick. Now it's somewhat longer. Before it used to be several days. Now it could take about 2 weeks. And after sponsor application is approved, then beneficiaries would receive an email with the request to complete their portion of the application, basically their own personal information and agreement for immunizations. And after, as soon as this information is entered into the electronic immigration file, then it takes approximately 1 to 2 weeks for the beneficiary travel authorization documents be delivered to the beneficiary. The two biggest errors or challenges are that typo error with the emails of beneficiary, or second, the biggest challenge is that beneficiaries email box would send email from USCIS to junk box, and beneficiary, so basically beneficiary has to check all their email boxes they have. But when they approved, approval lasts for 90 days. So beneficiary has 90 days to enter to the US. In some circumstances, when beneficiary are not able to manage leaving their country of residency and entering US within 90 days, they have a right to request extension. However, again, you have to be really cautious. So if beneficiary know that they are not going to be able to meet the deadline, they have to notify USCIS as soon as possible. There are some, again, anecdotal stories when beneficiary requests extension 2 days prior to expiration of the 90 days limit and being denied, stating you requested too late. So you have to really plan ahead.
Okay, I think, Julie, there is a question about why it's taking so long. I believe I would suggest you to check your account. If we not rely on emails only, definitely check your accounts, check the status of your application. If there's still no update, I would suggest to contact them directly. We do not USCIS don't have a tendency to report to anyone, definitely not to us. If you have any questions about their website or their application processes, I would suggest send them messages directly on their website. And I think we answered almost all the questions. We will still have time at the end to answer more questions. If you have something, or you definitely can email us with questions. Right now, we would want to dedicate a little bit time to our guest speaker, Andrew Kritovich, who's a licensed psychologist, and to talk about a little bit about tips how to work and live with war refugees, because I think it's really important for everyone who's bringing people from war in country with the war, that we all live in the state that we have a lot of, more than 16,000 refugees on this situation, and I think we want to share a little bit tips that how can we help those people. Okay, thank you.
Yes, it's great to see you all, and I really want to thank you everyone for joining this call, because I understand some people are thinking or they already became sponsors, and it is important. I really want to thank you for doing that, because it is something that is very important for our community. I will try to be as quick as possible, and we will talk about mental health or emotional support that refugee need. Prior to that, a little bit about myself. I'm a clinical supervisor at Ukrainian Community Center, and we have the program that support refugees with emotional support, mental health, and also for majority of my career since early 90s and for about 25 years being in US in some form or another, I was doing counseling, mental health therapy. I was overseeing, and I was clinical supervisor overseeing some mental health programs. Also in 2016, working together with United Nations, we did some seminars in Ukraine at that time for psychologists and social workers who were working with people who are fleeing at that time known ATO zone or ATO in Ukrainian. So also we conducted some webinars for psychologists and social workers that basically worked on the front line at that time. Today, my limitation, and I want to state it right away, it's not deep, comprehensive presentation about mental health. I just want to talk about importance of noting and providing emotional support for refugees who came to United States. So my goal is not to go through my PowerPoint no matter what. My goal is not to have to create, death by PowerPoint, where sometimes we just sit and look at the slides. I just want to provide the main idea about importance of this work. Because a lot of time, and truly so, when newly refugees, they come into United States, we are thinking about where they're going to live, what they're going to do, about the language, about benefits, about immigration status. And that's all true because, as we know, Maslow's hierarchy of need, that's the basic need, basic necessity that's supposed to be fulfilled. But in all this, as we all know, a lot of time, mental health can be either powerful aid or barrier for refugees to adapt in the life, in our case, in United States. Because sometimes we feel like, oh, person probably need to find a job, and person is depressed and sad or anxious, or families start falling apart and we don't know what's going on. And a lot of time, this is a result of previous trauma. So again, my goal is not to provide some kind of today psychological first aid, but just to talk about the importance of recognizing emotional support and probably directing person toward the right help. Very quickly about refugees. Also limitation of this presentation. I know in United States, refugee status is different from United Nations definition of refugees. So United Nations provides meaningful definition of who are refugees. As we all know, probably to some degree, that refugee status, it's more legal status that refugee may or may not receive in United States. So whenever we will talk about refugees, I'm not talking about US definition of refugee status. I'm talking about meaning, the purpose. We do have refugees that are coming and escaping from war zone, and this is who they are. And we want to support all refugees in that. So when we talk about mental health, or as a lot of time when we speak with refugees, because mental health, it's not translatable term to a lot of languages, we are saying emotional support, or in Ukrainian, we are saying emocійна підтримка, when we are trying to really provide support for the person, so person can have self-efficacy, can have agency over life and adapting in the United States. And that's what's important. And when we think about mental health is very layered. There are a lot of situations that affect mental health. So without providing any deep professional definition, I would just say that mental health is how person feel, how person think, function, and how, and that's probably the most important, how able person is to pursue happiness. As we know, in the United States Constitution, we all know it's part of the preamble where we are clarifying and we are stating that people pursuing happiness. So mental health, again, can help with that or impede this process where person is unable to function and pursue happiness. So this is a little bit about our definitions. Now, when we see average refugee who came to United States and probably fleeing again, either it's a long time, years, if person is coming from southeast of Ukraine, where conflict is going since 2014, or maybe it's more newly acquired trauma after beginning of 2022, when full-scale invasion by Russian Federation started in Ukraine. So we will see that all those three areas we have on the screen, they do affect person. They do affect how person think, how person feel, how person is able to be resettled. Because again, this is the most important part during resettlement, and for many refugees, it's not even clear yet because of the immigration status. I don't want to touch on that. I know you have that information, but adapting to life in United States, definitely it is benefits, immigration status, housing, all this important, but it's also ability to have agency over own life. If I don't have agency over my life, many services may be provided to me, but I will not be able to adapt. So when we work with people and when we sponsor people and when we meeting refugees who are coming here, there is something to know. Because of course, probably majority of people will worry to some degree, and worrying is very normal process when we are changing countries. Even if, let's say, person is not escaping war, just simply moving to another country for whatever reason, it is stressful time. But when it goes beyond regular worries, that's probably when we need to note and possibly refer or seek further consultation. So statistically, for refugees who are escaping war zone, by definition, rate of depression is higher. Probably person never experienced depression before, but now at some point feels like it's hard to wake up, or it's hard to fall back to sleep, or it is hard to actually navigate every aspects of life. That's one. Another, post-traumatic stress. And it can be either direct, simply speaking, or indirect. Direct when person experience bombing and fleeing when they heard somebody shooting or bomb for exploding. It can be indirect. Maybe people are fleeing from zones or from areas of Ukraine where active war was not happening, but being part of the process, it can create post-traumatic stress. And in some cases, PTSD reached 10 times more than average population. So it's good for us to remember. Another very general note, it's intensity, frequency, and duration. That's what I want us to hear from this slide. Because when we talk with people, probably we sponsor our relatives, somebody who's coming as a refugee to the United States from Ukraine, that's the key, intensity, frequency, duration. The more person spends in each of those three categories, probably the more emotional support they will need. And also when now the question is, how we talk about that with person who needs help. And I have some tips at the end, but generally speaking, we know that in United States, emotional support or mental health needs, they are viewed differently than in Ukraine. In Ukraine, a lot of time, although to be honest, in recent years, the importance of mental health, importance of emotional support is raised, and people are more aware of this, but people still don't have experience with that. And a lot of times when they hear emotional support or mental health support, they feel like I'm not crazy. Because a lot of time people can still thinking back old Soviet time when it was part of the psychiatric asylums, when people were placed and all the support was provided against their will. So just education about importance of that area of our life, of mental health and emotional support. And in the United States, it's not viewed as some kind of blame or some kind of a rubber stamp that it will stay with you for the rest of your life. It's just to receive emotional support during the time of need. Again, from this slide, it's also good to remember, because a lot of time refugees who are coming here and after about a year, give or take, what we see that kids adapting to life here much faster. They learn the language faster. And there are a lot of conflicts around different issues where parents are saying, I was helping you, and they don't really clearly understand a lot of time why whatever is happening, why is they losing kind of communication with their kids. So as sponsors, we can normalize it. We can direct people toward the right resources. We can say that this is very normal reaction for the abnormal situation. So people can be prepared in families when there are conflicts or something like this, that they can work on that. So because our time is flying fast, I just want to focus more on applied questions. So it was more kind of background, very quick background. But now it's more applied. Questions probably people will ask. Questions probably we will have about mental health, about emotional support. And people may ask, probably first question in one way or another, is it common to feel distressed during, after fleeing from war? Or is it just me? And it is very important because a lot of time people are not talking about mental health right away, right? When we meet each other and we ask like, oh, how are you doing? I mean, majority of people do not say back like, oh, you know, I cannot sleep. I feel very bad. I'm feeling depressed. No, we feel I'm okay. It's hard, but I'm okay. And people can have this idea, maybe whatever is happening just to me. I need to hide it. I need to somehow cover it. I don't want to be labeled crazy. If I'm worrying too much, maybe I'm depressed. Like, what's going on? First, it's very good in many conversations with people, either we are sponsor relatives, refugees we working with, it's to normalize. Again, saying it's very normal reaction in a normal situation. Majority of people who are fleeing war conflict zones, they do feel something like this. Because that's what is important to hear for newly arrived refugee family. It's not only you. If suddenly you start having conflicts in the family and you wonder, like, we never had it before. Why now we argue about everything? It's part of that. And your word, and I'm not saying about being professional, just simple peer support word, saying, you know, it happens to many people. We can work on that. Meaning not you exactly, but we as a society, as a support system, as relatives, friends. So it's very important to know. Second, what is good to remember, how would I know if I need emotional support? Very simply, if person is asking something like this, or we having conversation, it's whatever preoccupies person. If it's affecting daily life, whatever, stress, depression, it really affecting person's ability to thrive in life. And people feel like I cannot just shake it off, because that's what a lot of time people trying to do. And in many cases, it works. I'm not saying every person who will come to United States from Ukraine will need emotional support. That's not my statement. A lot of time people do feel better shortly. They do find some kind of natural tendency to stay well emotionally and in their mental health. But a lot of times they cannot. So if you have any questions, please feel free to connect with us. Because if you see something more than average person would have, again, as we discussed, anxiety, depression to some degree, it's very normal process. But if person cannot just shake it off in relatively short period of time, probably they need help. Sometimes people can ask, like, but what I can do? Can I help myself? And the answer is yes and no. Yes, probably first answer. Person can try. Person can try again to be outside. As we know, if person is outside for at least 30 minutes a day and person is active outside, our body, our brain produces almost the same amount of neurotransmitter comparing to antidepressant medications. Just be outside, be emotional, talk to other people, go to support groups where people just talk to each other with the same experience and see other person experiencing the same, so they feel better. But again, the main point is, if help provided, but improvement is not there, that's where probably person need more professional involvement. So, answer is yes, do what you can. But remember, if it's not working, there is still help available for you. How would I know if my friend, family member need emotional support, or whoever I sponsor? Very similar to question number 2. Again, main definition, if person has symptoms more than average person would have. That's probably one of the key, because everybody can be anxious, depressed, as we discussed, but it's more than average person. Person cannot relax. Person always tense and worry. Person cannot enjoy good activities. person starting to isolate oneself, like, let's go to a Ukrainian club meeting, or let's go to the place of worship, to the church, let's go, and person, I better stay home. It is a warning sign if it continues. Increasing of conflicts in the family, misunderstandings. So again, if it's more than average, feel free to talk to a person and probably at some point refer to us. Again, people are saying, no, I'm not just worrying. I'm worrying about, as we discussed, housing, USCIS issue, DSHS. I'm fine otherwise. And that's a lot of time what people would say, because people will not present themselves like, oh, you know, I have issues with depression and I'm clinically depressed. Seems like nobody think this way. People just worrying about everyday stuff. But if it is more than, again, average person would have, that's probably emotional support is needed. Again, we talk a little bit about kids. Do they need emotional support? And as we know, kids, and I'm not talking about toddlers, I'm talking about teenagers, I'm talking about preteens. Their experience of trauma or their manifestation of that experience is different from adults. If adults more tend to be depressed, anxious, kids usually act out. Their grades are going down, they start having conflicts in school or in neighborhood or in a family or in the church, and they act out. Please do prepare family for that. So family would understand. It's not something that they should, for the lack of better term, freak out about. It's part of what expected. There are interventions. And if it's going above and beyond average situation, probably we need to talk about it. Sometimes people are saying, I'm a strong person. I have family, friends, church. Do I need help? I will be able to pull it through. And again, I believe question number 3, as we discussed, if people can do this, great. It's great to have family, friends, neighbors, church, all the support network. It's great. But again, if it's something more, there is nothing wrong. And that's the message we can give to people, to families. There is nothing wrong, especially we can frame it here in US, because outlook view is different, to ask for help. Emotional support is needed. And as we discussed in previous slide, in US, we also, as part of what we do, we're trying to help connect people with different systems, provide some therapeutic case management in order to stabilize the person. And as we can say, okay, I see now my friend, my refugee I'm sponsoring, they need emotional support. How can I talk about it? First, show your concerns to the person who is struggling. They need to feel it, that you care. That's what is important. People have this natural tendency to feel who really cares and who not. Show them that you care. Ask about it very plainly, like, seems like it's harder, you're worrying a lot. Let's talk a little bit about it. Maybe we can work around this. Maybe we can ask other programs to support you. Ask them and be able to listen, so they can talk about their well-being. They will feel safe with you. Again, we are not asking to do like mental health therapy right there. Just being human being, talking to another human being. Just provide safe space so they can probably tell something they didn't talk to anyone before. And encourage them when you feel it's more. Then again, as we discussed, this keyword, as average person would experience, encourage them to seek emotional support. Give them information about our program or generally, because they may need help. And if help is provided in the right moment, they can thrive in life. And again, I know my time is almost up. Definitely, we can talk a lot about this. I hope at least briefly we realize how important emotional support is and how it is impacting to all other areas of life. So I will stop there. Irina, back to you if people have questions about anything that was discussed today.
Thank you, Oleg. It was really useful, and even though time was limited, it was really good information. Thank you so much. We have approximately 4 minutes for more questions. I know might not be able to answer all of them. Olga just added to chat our email address. That also feel free to connect with anyone from our organizations. You have all our websites. You have a Metut website that also lists all our organizations. Each of website has also how to connect with us. Not only if you don't remember our emails or our names, still have our website and names of our organizations that will help. We'll all try to help with any of your questions.
Just real quick to add, I see the questions is there the kind of sample form with hypothetical names how to complete. Unfortunately, there is none. But if you have a question how to complete the form, please call our agency. If we'll have time, we'll lead you through the process. If not, we have volunteer attorneys who would help you going through that process. In addition to our main number that you would find on the website, we have a dedicated line, which is 206-636-5508, and I put it in the chat, 206-636-5508. Few minutes left. It was a question about has a person who receiving public assistance is the same under the same rules of the limitation on the public assistance. Basically, if mother with a child is not able to support herself and the daughter with a child care, again, there's a number of programs. If this is the main obstacle of getting employment, there is other options available for daycare that would be paid by the state and so on. So DSHS is working on that issue and are there to provide assistance whatever they can. So non-refugee gonna be punished if they're not able to work otherwise.
Yep, basically, I think we answered almost all the questions. Also, Olga posted the link to the second presentation. It's not our presentation, it's coming from welcome.us, the agency that actually we work with and helping us with all the information. Really good stuff. I have no idea if they will record and post anywhere. So I would suggest you to register for it. It's free, obviously. And if you cannot attend, just reach out to them and ask them for a recording. I don't see any other questions for now. So if you, again, if you have any more questions or worry about something, reach out to any of our organizations and we'll try to help as much as possible. Thank you for all for coming. Thank you for presenting, everyone who was talking, and hope to see you next time. Please share this information with your friends and family. And join us in our next events. Thank you.
Thank you, everybody. This was great. Thank you.